Are you wondering about the influence of birth control on your hormone levels? Maybe you recently started a birth control and you're having some funny side effects or problems. And in this video, we're going to look at this question: can birth control mess up hormone levels? My name is Dr. Taranella, and we're going to look at some of the direct influence of birth control on your sex hormones and some of the unintended consequences of birth control on your hormone levels. How long will it take for your natural hormone production come back online after you stop birth control, and other questions like this. So if you like this kind of information on hormone levels, health, nutrition, just trying to kind of understand what's going on in your body and your health, click on the like button and don't forget to subscribe to the video to get more videos like this one. Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or a medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. All right, let's look at this question. Can birth control mess up hormone levels? Can birth control mess up hormone levels? Well, birth control definitely changes the amount of hormone levels that the female body is producing. That is the main objective of birth control. In fact, the main way that birth control works is inhibition of ovulation and follicular development, which then changes the output of estrogen and progesterone, which are the main hormones that females are producing. Because the birth control contains synthetic versions of the estrogen and progesterone, the body is still getting the signal that they're getting these hormones. They're just slightly different, and so you may get an overstimulation or an understimulation in some tissues, and it kind of depends on how the person responds to those hormone signals. They may not respond well to a certain birth control because of that. But overall, by and large, the way that the body responds to the birth control usually is not drastically noticed on the hormone tissue receptor level. And of course, there's individual cases. You will see people not responding well to certain types of birth control. So yes, there are changes in the female hormones, and it sort of messes up the overall signaling and the hormones that are being produced. Now that can last for several months after stopping the birth control. That can still be going on. And one study looked at this specifically. One study followed hormone levels of women that were on birth control and then stopped taking them. And they found that the luteinizing hormone and follicle stimulating hormone were much lower in the first month after stopping the birth control. And then by the third month, it was starting to climb back up again. Some women also had lower production of progesterone and estrogen in the mid-cycle, which kind of corresponds with reduction of the luteinizing hormone and follicle stimulating hormone. By the end of the third month, most of those hormone levels were climbing back up. So when stopping birth control, we expect that the pre-hormone levels will come back to what they were prior to starting birth control in about 3 months. And when this study that I'll link to in the description did find that some women took longer than 3 months. So depending on which one you're taking and how your body's responding, how sensitive you are, maybe you may take longer than 3 months for your hormones to get back to your normal baseline. So that's just one side of the coin. Can birth control mess up your hormones? And the answer is yes, they can. While you're taking them, they're definitely going to be, your hormone production is going to be changed. But it also brings up another thing. What about other hormones outside of the female hormones, like testosterone, cortisol, things like this? So it turns out when you are on birth control, there are some other unintended hormonal effects on your body. And this may account for some of the side effects that occur with birth control. For example, many studies have found that sex hormone binding globulin is much higher in females taking birth control. And so what sex hormone binding globulin does is it binds up all of your hormones that are floating around, particularly like testosterone and estrogen. So any estrogen that you do produce is going to be bound up, but then on the level of testosterone, that's going to be bound up too. And so your overall libido and drive and things like that may be much less. So basically your bioavailable testosterone and estrogen is going way down. It's also commonly known that birth control reduces the amount of testosterone output. So not only is the bioavailable testosterone low, but the overall output of testosterone is also low. And this occurs through the same kind of mechanism that's inhibiting the estrogen and progesterone. Just the overall hormones in that overall cascade are decreased. And it's because of that decreased sex hormone production that some of the hormones are shuttled over into producing things like cortisol. And so you'll see if you do a test on your cortisol, many women that are on birth control will have much higher cortisol. And that's also going to have effects on things going on in your brain, like the stress response and things like this. So the sex hormones are not being produced at the same abundance, but you have the synthetic versions to kind of offset that. But you still have high cortisol over here, and these synthetic hormones that are offsetting what your body usually makes are not always going to act the same as what the bioidentical hormones that your body is naturally producing. Sometimes they will overstimulate certain tissues and sometimes understimulate other tissues. So keep that in mind when you're having some side effects from your birth control or some weird things happening when you start birth control. Some of these physiological things that I described in terms of the birth control messing up your hormones can account for some of those side effects. And you just have to weigh whether that's, the risk-benefit ratio works out for you and what you're needing for your health right now. All right, that should give you a better understanding of the influence of birth control on your hormones and answer the question, can birth control mess up hormone levels? If you do have any other follow-up questions on this topic, drop it in the comment section and I'm happy to answer your question. And I may do a separate video on that topic. Thanks again for watching. We'll see you next time.